Hello, and welcome to another episode of Plastic Surgery Unfiltered, a podcast at the intersection of healthcare, business, and the beauty industry. I'm your host, Dr. Armando Davila, joined by our usual co-host, Dr. David Turer. How are you doing?
Great. Good morning.
Good morning. Today, what's our title?
Keeping the edge sharp.
Keeping the edge sharp. The ideas of continuing education in plastic surgery and aesthetics and growth in general. Yeah. This podcast is going to be a little bit of a roller coaster, but let's start with Baker Gordon.
Sure.
So Dr. Turer and I just came back from the Baker Gordon Symposium, which is the longest running live aesthetic surgery symposia in the U.S., and it was actually the very last one. It's been running for 60 years.
Yeah.
How'd you like it? What'd you think? It was our first one. And
it was. I mean, you know, I when I heard that this was going to be the last Baker Gordon, I really wanted to go because it's really considered probably the top meeting when it comes to technical education and aesthetic surgery, maybe in the world. And a big part of Baker Gordon, like you mentioned, is live surgery. So you have some of the best, or at least the most well-known aesthetic surgeons in the world, and they come and they do live surgery in Miami, which is pretty darn cool.
Yeah.
It is a completely different experience from any of the other meetings I've been at. And my only regret is that I haven't gone before.
Yeah, to more of them.
Yeah.
Yeah, I remember I leaned over to you and I was like, oh, this is an interesting recording. You're like, no, this is live. I didn't even know that that's what it was.
Yeah.
And it was more impressive at the end when they talked about how they've been doing it, you know, since the 60s. And I really thought about like what that meant technologically, right? Like nowadays they have headsets, we have Bluetooth, we have all this like, you know, webcam stuff. And I was like, back in the 60s, they probably needed like a TV film crew and like, you know.
Yeah, I can barely imagine what it took to do that.
Yeah.
But I mean, just for some historical perspective, obviously there were these two surgeons, Baker and Gordon. And in the late 60s, they really felt that there was a lack of education in aesthetic surgery. And aesthetic surgery was still very much in its infancy then. And so they started this symposium, my understanding is basically not only to educate others, but also educate themselves. And the idea was that people would come and do live surgeries so that you could bring some of the experts from around the world, and then in real time, people could interact with them to understand how to do these procedures, not just that the procedures exist.
Yeah, I mean, gosh, we watch a lot of recordings of other people operate, but there is something to be said. Even when you watch a recording of someone operating and they're the one presenting their own recording and you have a chance to ask them questions, it isn't the same as like asking them while they're doing it.
Well, and I mean, like, credit to guys like, you know, Stuzen and Rorik who kind of moderate these things because they're exceptionally good at saying, "What, you know, hang on a second, Tim, what are you doing there? Why are you doing that?" And they would say, "Oh, well, you know, I figured out this because of this, this, and this." So you just gained, you know, you took someone's maybe 10, 20, 30-year experience and summarized it in a few sentences. And that was incredibly powerful.
Yeah, I did think that the whole, you know, the whole medium is, it is very powerful, and I think that it's also powerful in reverse, right? Again, if you're going to be a surgeon who's presenting these live surgeries, right, it takes a lot to have your techniques and your stuff sort of dissected publicly as it's going. And what were they presenting, right? It's like you can feel it in the room when the room doesn't like what's happening, you know?
Well, that's what they said is that, you know, even these guys that were, again, they're some of the most proficient surgeons in the world, they get nervous up there and, you know, sometimes things don't go the way they expect and they have to pivot. And I mean, it sounds like over the years, there've been some really contentious moments there.
Yeah. I mean, like, you know, every surgery has, you know, all surgery is hard, and I never think of any surgery as routine. Every surgery can surprise you. And one of my things I tell everyone is, right, everything in medicine is dangerous. Mm-hmm. And so you have to be prepared for any of those eventualities. And so, you know, when it's happening sort of in the privacy of your own operating room, that's one thing, I think. And
as opposed to showing it to an entire auditorium full of your peers.
Correct. Yeah. It can be pretty nerve-wracking. You know, it's one thing I think is I disagreed with was the idea that it is, that it's not possible, or like they kind of suggested this idea that it's like very rare or very difficult, right? In some ways, I feel like I do live surgery every time we operate on an awake patient. It's like they're awake, that we're talking to them. Like there's no it has to be controlled within that environment.
But I think, we talk about this sometimes because it's very interesting how I think as plastic surgeons, what we do, our results, those kind of things, we think about them in the context often of how our peers will judge those results.
Correct.
Right? And so like we may see a result that isn't technically perfect and we really hesitate to put it on the website or put it on social media, not because it's not a good result or because we think patients aren't going to like it, but we think, what are the other plastic surgeons going to think about this?
Yeah.
And it's interesting that there's that dichotomy of, whose opinion are we thinking about?
Yeah, I mean, I think that you tie back in TikTok, and that's kind of important here because the problem with one of the many problems with social media is the attention span and the snippet mindset, right? It's like the reason why the live surgery is so effective in some sense is because you get to experience it from start to finish.
Right. Like an hour or hours at a time.
Yes. Like, you take one of Tim Martin's facelifts, right? That's this like 8-hour saga. And even when Tim Martin even if he's recording his own video and then has to chop it up for a meeting, right? When he presents it at ASPS or Aesthetic Society, he has to select these like little moments to highlight.
And it's the thing that he thinks are the most important, but what he may not appreciate is for someone that's not as experienced as he is, maybe there's other things that happen earlier in the process that are actually more helpful or just as helpful.
Sure. He also might have bias because he might snip the things that look most impressive to himself. Because again, a lot of these meetings is about presenting people. And so I think that when you see these technique things, right, I was scrolling again through Instagram and there was this little animation of this surgeon doing this sort of minimally invasive lift. And the diagram, the animation is showing you this like endoscopic style lift, but the video is of him doing not that.
Right.
It isn't even remotely close. And I go, he posted because he thinks or he interprets that the patient or the consumer does not understand the difference, and they probably don't.
Right.
But the diagram is showing this like super slick, minimally invasive thing, and he is showing this like wildly maximally invasive facelift, and then he's like, look at her before and afters, and I'm like, well, yeah, because you didn't do this sham surgery that you're posting a diagram of.
That made me think of something that they talked about. Sort of one of the lectures at the end was talking about the evolution of Baker Gordon, and it kind of speaks to the evolution of plastic surgery. And I think we wanted to talk about continuing education. And I mean, when you think over 60 years, the number of techniques that have been presented as cutting edge, I mean, every year what was presented as cutting edge, but the things they were doing in the 70s and 80s and 90s now would be seen as totally outdated.
I mean, Dave, I have to disagree with you on that. I went and told my mom about Baker Gordon, and I told her how like Hoyos is like fracturing ribs, and she goes, they've been doing that forever. And I was like, what, Mom? And she's like, yeah. When I was in the 80s and 90s, like they were removing ribs and doing all that sorts of stuff in South America. Like that's not new. And I go, well, I have to take your word for it. I was like 5 or whatever.
I've heard. I guess what I mean though is like, not everything that's been presented there is always a great idea, right? And
sure.
Some have stood the test of time, and some haven't.
And some are being recycled. I think this is the fascinating thing, right? There was a huge argument again about like the plane of where A, the plane of facelifts, and B, the plane of where you put your breast implants. And it just feels like we make these big circular loops. And I think what's missing, right, is that as technology advances, we're capable of doing things that didn't work in the past because the technology, some things, now the technology is better, right? And so again, right, well, you used to be able to remove a rib or break a rib, but it was dangerous and the complications were high and the morbidity was really unacceptable, so no one picked it up.
Right.
Now we're like, oh, we have this new technique, this way of doing it, and a technology that facilitates it.
Well, and I think, we were talking earlier about, like offline, about like board certification and why that matters, right? And what you learn in training is sort of foundation, right? You learn the basics, and then we build on that. But without understanding those basics, like you can't fall back on them when the new technique or the new technology fails or doesn't work the way that you had hoped. And B, you don't have that context. Like we were saying, those guys with, decades of experience, they probably tried a lot of things that didn't work and landed upon these current techniques. Mm-hmm. But this is why it's so important to stay at the cutting edge of technology and techniques, but also have that perspective looking back of what has worked and what hasn't.
Yeah, I mean, like this is not to rehash our genomics conversation or kind of the NOVA protocol, but this is where this kind of intersection does come into play, right? I think that one of the things that people fail to realize is that American Board of Plastic Surgery, board certified plastic surgeons train for as long or if not longer than neurosurgeons and heart surgeons in this country. Like that's the echelon. It's neurosurgery, cardiac surgery, and plastic surgeons, right?
Yep.
Again, 4 or more years of undergrad, 4 or more years of medical school, usually because there's research and other stuff involved. Then you do anywhere from 6 to 8 plus years of surgical training. Okay. And then again, like we train for hundreds of hours during those, right? Mm-hmm. It's just when you go and you say, I'm cosmetic surgery boarded, it doesn't matter if you've done 100 cases to get that cosmetic surgery board. It just, the foundation is missing.
Right.
And so, again, I'm challenged and they go, oh, a pharmacist knows more than you about medications. Yes, a pharmacist, that's their specialty,
sure,
right? But like a pharmacist went to school, not to discount, again, pharmacists are great. They do great work.
Right.
But again, I went to school for a decade and a half to do this.
In the context of clinical medicine, like we have experience in what works and what doesn't. And so, utilizing, we may not understand the equations for the pharmacodynamics of a specific drug as well as a pharmacist.
I mean, I know that too.
Well, sure, but you know what I'm saying? Like, and then, but we know how to apply it.
Yes, it's translational. We know it through the entire spectrum, and I have a foundation of the pharmacokinetics. I have a foundation of understanding, drug delivery systems. Right. And so if a pharmacist comes to talk to me about it, I understand it, and I can relate with that pharmacist or any other thing we're talking about because the breadth is so great in plastic surgery. And we have to because, again, we liaison with nearly every specialty in the healthcare system.
Sure.
Like all the time.
Well, like outside of aesthetics, that's absolutely true, right? Like plastic surgeons help just about every other specialty, certainly every other surgical specialty, because in reconstructive surgery, we are there to help when things don't go right, or
Correct.
when, there's something that needs to be covered or reconstructed after something else. And so, you have to have some knowledge of almost all of the other surgical specialties.
That's correct. So when you go and you have, again, when you have a surgeon, like let's say you have, again, a cosmetic surgeon who has not trained in plastic surgery, and they go to a meeting like this, or they read about, I don't think if they can, but maybe not. Yeah. They read about the rib car, right? And they're going to fracture the rib, and they're at the outpatient surgery center, and then they give the patient a pneumothorax. They have a tension pneumothorax. That surgeon has probably never had ICU training, has never had critical care training, has never treated a pneumothorax in their life. That patient dies, right? Yeah. And that's what you're seeing, right? They posted these papers, right? Like, patients die from this procedure. Is it going to happen to you? No, maybe not, right? But do you know how to put in a chest tube?
Yeah, absolutely.
Yeah, absolutely. I know how to put in a chest tube. Right. I know how to handle a tension pneumothorax.
Not that you ever want to be there.
No.
But you have to be prepared when you are.
Sure. Again, like you did years of critical care and trauma medicine.
I did a full general surgery residency before I did plastics. So.
And again, I had several years of critical care and trauma training. And so like, we know how to take care of that problem should that problem arise. And so you have this, that is what lets you be cutting edge, because otherwise you're just experimenting on people.
Yeah, and then like you can't really recover if there's a problem.
Exactly.
And you don't have the context for knowing maybe what didn't work as well, so you can't improve those techniques.
Exactly. And so, right, like this is where you get into these problems, right? We see this in the injection community. We see these in the we were talking about peptides, and I want to do a whole episode on peptides. Right. But it's like, everyone is just buying it because it's the hot thing, and then sending people home with it, realizing that they don't know how to read a spectrometry graph, and they don't know how to see that there's heavy metals in the thing that they're buying, and they don't understand how FDA indications work. And we know all that because, again, of a foundation of...
Well, you mentioned something that I think is really important, right? And so I think a lot of practices see the plastic surgeon as like this, shining figure at the very top, right? But we here really feel like it's important that the entire staff, everybody in the company, receives continuing education because it helps them understand the basic processes and improve our outcomes.
That's correct.
And it's, I'm not talking about even just our injectors, right? The people answering the phones need to understand this, so that when a patient calls and says, I had a blepharoplasty and my eye hurts, they say, I need to make sure this isn't a serious complication. They understand that. And so it helps improve our patient care.
That's correct. I think that, our employee development was about growth and growth initiatives in the organization, and that, that's part of what we offer people, but also what we do internally. And, the idea that we have to keep and making sure that the staff is learning, growing, evolving, it's not enough for it to just be a mandate from above. Right. Those don't work.
It has to
right?
be. It has to be the culture of the place.
It is, and that is the culture of our place, which is we bring people on and we hire people who want to be part of growth, and that's how we again offer these cutting edge things safely, right? And they do. They need to understand it at least at some level.
Absolutely.
Throughout every part of the organization. It can't just be like us, right?
Yeah.
And that's why we managed to pull off things in this organization that other people think are impossible. And, the wake surgery being one of them, right?
Sure.
Again, the amount of people and the amount of misinformation I see from that, like these surgeons and these people are basically go out there and say it's impossible. No, it's impossible because it's impossible at your office with your team, with the
your
people,
system.
with your system that you've created. And
well, I think like what you were mentioning earlier, the people that kind of lambasted us about the NOVA protocol and about decreasing the use of narcotics, right? I mean, without our entire system functioning from start to finish, setting the expectations so that the patients know what to expect, having a great team to get everything ready so everyone has every component of that, and then everyone being able to pivot if patients need a little bit more so that we can provide them that extra medication. That's why the NOVA protocol works.
Sure.
You kind of shared this with me, and I share this with patients now because I think it's exactly right. It's a set of medications, but also steps and things that we do before, during, and after surgery to get you the best outcome.
Correct.
And, again, that's not just you and me. That's the entire team. In fact, 95% of it has nothing to do with us.
Correct.
That's the team.
Yeah.
And that's critically important.
And even at the late stages, right? Even at the surgery center, the anesthesiologist has to be involved, and they have to know what happens at every stage. And so, I think that we're hiring right now, and I'm going through the interview process, and I'm meeting with people and learning from them, what their feedback is about the interview process itself. And the reality is that this job is very hard.
Yeah.
We have a very high standard. We just talked about it, right? That this is going to be continuing education. You need to be learning. You need to be growing. And our patients have high expectations for their result. I would hope that they do.
Sure.
And we want to deliver on that. And so, I don't know. I want to expand on that. I think, why do you think sometimes this organization or the culture of this organization is difficult?
Well, I mean, I think constant growth is hard, right? It's hard constantly being retrospective and looking at yourself and saying, what am I not doing well? It's easy to just coast, right? It's hard to grow. And so I think not everybody does well with that.
Yeah, I mean, I will stand by that. I think people who work in this organization will grow faster than almost anywhere else, but only if they want to.
Right,
and
right.
They have to want to, and I can't force them to do it. And I think that's true. That translates to our patients too, right? Our patients come in and they will achieve transformative results in ways that they won't be able to achieve anywhere else, but only if they're part of the commitment to start to finish.
And if they help themselves, right? You're not going to come in here 150 pounds overweight and expect that you're going to get a good result. You have to lose the weight first. You have to put the work in first, and then we can help you take that next step.
Right. And I think that's true through the entire process. Again, we talk about so many of these things. We can, we're really trying to redefine what it means to offer laser services. Again, not just get a device and sell a laser. We're really trying to create something that is next level. But these services now are more advanced, and they require patient commitment and patient interaction. And there's a start a beginning, a middle, and end to the whole thing.
Right.
And so like if the patient doesn't want to participate, then we really can't deliver that. And so this isn't your walk in, walk up med spa, come in lunchtime, whatever that kind of, whatever that was. And I think that like we overvalue convenience in society, and that we think that if it's convenient, it's better.
Yeah, I mean, I think obviously, there is still a craftsmanship to what we do, right? And craftsmanship takes time and it takes effort. And in our case, that has to be invested both on our part and on the patient's part.
Yeah, I think that another reason that I think about the history of this place and kind of how I started everything and how I started changing the culture when I kind of came into things. It's that, like I wanted to rebuild this place rather than watch it sort of slowly decay.
Sure.
And at one point I realized that the standard I held in my head for what we were delivering wasn't the standard that was contained within the building. And that required change. And so, you see a lot of the kind of the patients that have been here for some time, wonder like, well, where is XYZ and where is this person and where is this person? And I go, well, that person wasn't to the standard that we expect for the organization and was not interested in that growth.
I mean, if they didn't fit into the culture of ongoing growth and education, then they're not gonna work well here.
Yeah, and I'm sure you've seen this like in even plastic surgeons around the country, right? They don't go to meetings, they don't talk with others, they don't learn new techniques. They're still doing something from like 20, 30 years ago. And again, they may be doing it for a long time, so they deliver generally consistent results.
Right.
But they have no feedback loop, so they're not even seeing when it doesn't work.
Well, that's, it's easy to do that, right? Like we were saying, growth is hard, and being introspective and looking back and saying like, did this work well? Like that's hard, right? And you have to be very honest with yourself to be able to take that and say, okay, this didn't go well, or this didn't go as well as I like. How do I improve that? And some of that is just from internal, but also going to meetings like Baker Gordon. You're like, you know what, maybe I can take this piece of something that I learned to improve my practice.
Right.
And so, some of it is internal innovation and some of it is taking ideas from others to produce the best result.
Yeah, and I struggle when you kind of become insular, and this is what I love about group practice as well, why I think that solo private practice gets challenging, because you have no litmus test for when you start to drift, like if it's making any sense. And ego starts to get built, and you don't really get to see when you yourself are cracking. And so, it's the culture we built here. We're hiring for new positions because, again, we're continuing to grow. We want to expand to more surgeons. But it's not a job that is taken lightly. This is growth through and through. And I'll hold people to it just like we hold ourselves to it throughout the whole process. So, I mean, plastic surgery isn't casual.
No,
nothing about it is casual. The training isn't casual. The credentialing isn't casual, and
the continuing education is a lot of work.
Yeah, and so thank you everyone for joining us. We have a podcast probably coming up on something we learned, peptides. That's going to be up soon. Join us next time.